start this topic. The planes are basically the imaginary lines or two-dimensional surfaces which are dividing the body into some components which can either be the right or the left component, the top or the bottom, the cranial or the caudal, or the interior or the posterior. Okay, so what's the benefit of the planes? Basically, they are used to describe the positions and the movement directions. The planes give you an idea about the axis, and then on that axis the movement is occurring. So on the basis of the axis we classify the joints into the monoaxial, biaxial or multi-axial joints. So these axes come from the planes. So in that sense you must have an idea about the planes in order to classify the joints as well. So let's just start our plane topic. We have a sagittal plane. The sagittal plane is further divided into two categories, that is the parasagittal plane and the median or the mid-sagittal plane. Okay, so we have these two subcategories of the sagittal plane. Any plane which is dividing the body into two equal right and the left half is your median plane or the mid-sagittal plane. Okay, so as you can see, this is the median plane. It's dividing the body into the equal right and the left half. This is your right half and this is your left half. But if we pass any plane, like it's also dividing your face into two half, it's dividing your body into the trunk into two half, okay, your lower limb also into the two half. But if there is any plane, you can see it here that this one is your median plane. Wait this sec. Okay, so this is your median plane, and any plane which is parallel to the median plane is your parasagittal plane. Okay, and it's also called as parasagittal plane or the. It also divides the body into the right and the left half, left part, not halves. It does not divide the body into two equal halves, but it divides the body into the right and the left parts. Whereas the median plane divides the body into two equal right and the left half. The parasagittal plane is also called as a para-median plane. Mean it's parallel to your median plane, and median plane is basically any plane which is dividing the body into two equal halves. So it's also called as a mid-sagittal plane. If you bring the sagittal plane towards the midline, so it's a mid-sagittal plane. If you bring the sagittal plane to the parallel to the median of the body, it's called as a parasagittal plane. Okay, till here I think everything is clear. And let me give okay, so we have read here that the plane describes the positions and the movement directions. So let's see which movements are basically occurring in the sagittal plane. Before learning this, let me tell you a tip here, that is axis is always perpendicular to the plane. Okay, ignore the writing here. Let me just write it on. Here to the plane. Okay, so this must be in your mind while you're learning the movements which are basically occurring in a particular plane. Okay, so let me draw some okay, so for the median plane, this is your median plane, so the axis must be perpendicular to it. There is an angle of the 90-degree here, as you can see, and this is your plane, that is a median plane, and this is your axis, which is basically the horizontal axis. Now any movement which is occurring in a horizontal axis is your movement which is occurring in that median plane or the mid-sagittal plane. Okay, so you can see it here. If we draw, this is your elbow joint and this is your axis, the horizontal axis. Okay, now same here, this is your ankle and this is your horizontal axis. It's basically not a 3D, so you would see it's slightly oblique, but it's like putting a pencil near your ankle joint. Okay, now here this is the spine and this is your axis. Let me just draw it here also. So This is your one spine, this is your second spine, and the movement is basically occurring here. Okay, so this is your plane. Now let's just see the movements here. You can see here at this plane, this is your movement, and this was your axis. This was your axis, and this was your movement here. As you can see here in the ankle joint, this is the movement is occurring here. And now we are having our spine movement. Basically the bending in the forward direction and the backward direction. Like if you are bending here, or like again, so that's your spine flexion and the extension. So this movement is called as the elbow flexion and the extension. Elbow flexion and extensions are occurring at the extension. Are occurring at which plane? That is the median plane, and which axis? Horizontal axis. This is the dorsiflexion, the one dorsiflexion and plantar flexion. Plantar flexion here. Okay, so if let me just tell you, this one is the dorsiflexion, in which we are going upward. Okay, and if we move it more downward, that will be your plantar flexion. Okay, and this was your spine flexion and the extension. So any movement that include the flexion and the extension. So the keyword that you can remember here for this movement, for this plane, is flexion and extensions occur at the median plane, horizontal axis. Okay, median plane, horizontal axis. So I will also give you a short demonstration of how you can determine that which movement can occur at which axis and which movement can't occur at that axis. Okay, so our second plane is the frontal or the coronal plane, and you need to remember the alternative name of the planes also, because in the BCQs they might give you the other name of the plane, so you have to choose from them. Okay, so the frontal and the coronal plane divides the body into the anterior and the posterior parts. Okay, so the front part is your anterior one and the back is your posterior one. So it's basically here. Okay, so its axis will be its axis is like this, entering. Okay, this is your axis. So we have three axes now, and if we talk about the three-dimensional part, so in the maths you must have read that this is our xy plane and this is our z plane. Okay, so we are taking this part here as an axis. Okay, so this is your frontal plane. Okay, the plane is your frontal plane, and it's dividing the body into the anterior and the posterior part, and this one is your axis. Okay, this is also an angle of 90 degree. So this is your axis here, and this axis is basically entering your body and leaving it from behind. So this is basically we will just making it one axis type. So this is basically entering your body. It enters from front and leave from behind. Okay, and here it is leaving from the behind. So this is your axis with respect to which plane? Frontal or the coronal plane. So if you draw a line over here, okay, remember one thing, the elbow joint is a multi-axial joint, so it includes the longitudinal, the horizontal, and this what we call it, also the horizontal axis. It's also the horizontal axis, but it's antero-posterior axis. Okay, so it's the antero-posterior axis. So your elbow joint includes both, and in the above one, the horizontal axis called as the left right axis. Okay, left right axis. So here this is basically your anterior posterior axis here at the sorry, not elbow joint, it's shoulder joint. And here it's also, it's basically like this. And this is not your ankle joint. Okay, this is the inversion and the eversion occurs at which joint? That is a subtarsal joint. Remember one thing, your ankle joint is the joint which is being formed between the tibia and the fibula and only the tarsal. Okay, only one tarsal, that is basically the talus. Okay, so that's the joint, these are the component of the ankle joint. And the subtarsal joint is basically formed between the talonavicular, calcaneo, cuboid. Okay, so these are basically subtarsal joints. And here at this joint you will get your inversion and the eversion. Inversion is basically moving your foot slightly inward, and eversion is moving your foot sole slightly outward. Let me give you a demonstration over here. So you are moving your, see, this one is eversion, in which the foot is getting out, and in which the foot is getting inward, like here in this direction. In this direction it's the inversion, and in this direction it's eversion. Eversion. Okay, so this is, so that's basically in which axis? Anterior posterior axis. At which plane? That's basically a frontal or the coronal plane. And which movement? The inversion and the eversion. Same here, you can see that's basically the abduction and the adduction. Abduction is basically, I have told you guys in the previous video, that is abduction is moving away from the body, and adduction is basically moving towards the body. Remember, the add means adding all the things together, so that's basically the adduction. And if you are moving away from the midline, that is basically the abduction. So here the abduction and the adduction are also occurring at which joint? The shoulder joint. Which axis? Anterior posterior axis. Which plane? That is the frontal or the coronal plane. So this is basically our third movement, which is basically occurring at our anterior posterior axis, the frontal coronal plane, and that is basically the lateral flexion of the body, or the trunk you can call it. That is, you are moving away from the midline. Let me draw an imaginary midline for you guys here. This is the imaginary midline, and this is, okay, this is the imaginary midline. And if you see, you are moving away from that midline. So that was what? Your lateral flexion of the spine. Now this is our last plane, not the last, we have one more plane left, but that's not important that much. That is the transverse or the horizontal plane. Transverse plane divides the body into the top or the bottom, or the, yeah, top and the bottom, or the cranial and the caudal parts. Okay, that's your cranial part, that is towards your brain, and the caudal is called as a tail, but that is downward part, or the towards the lag, or towards the tail. That is, you can also call as top or the bottom part. So it's basically dividing your body into top or bottom, cranial or the caudal components. And what will be the axis? That must be perpendicular to it. So if we draw a line over here, that is the longitudinal axis, which is perpendicular to the plane. This is the 90-degree angle, and the axis is basically the longitudinal axis here. Longitudinal axis. And let's just see some movement over here. This is basically, let me just draw a longitudinal axis here. Okay, let me just draw a longitudinal axis over here. Let me just draw a longitudinal axis over here. Okay, so if something is entering from here and leaving from behind, that is your anterior and posterior axis. Right? If something is along the long axis, that's your longitudinal axis. Okay, so there is difference here. So that is your longitudinal axis. Now we will see the movement over here, and we will then name them. So basically, if you will see here, that's called as the horizontal abduction and the adduction at the shoulder joint. This one is basically the lateral rotation and the medial rotation at the elbow joint. And this one is it. This one, the palm, when the palm is upward, that is called supination, and when the palm is moving downward, that is called as a pronation. So all these movement, that is, let me just write them for you. First one was the horizontal abduction and adduction. Lateral and medial rotation at the arm. Sorry, not arm, that's elbow. At elbow joint. And the pronation and the supination at your wrist joint. Not the wrist joint, it's basically in ulna and the radial joint. Pronation and supination. At the radio-ulnar joint. You will be able to remember all these movements much more prominently in the locomotor module. Okay, so if you are not being able to remember all these movements, so that's pretty much okay for you guys. Just remember the planes and how they are dividing the body. That's more important at this level. So these are basically the plane. Now we are left with one more plane, that is the oblique plane. So the oblique plane is basically any plane which is dividing the body at any angle except 0 degree and 90 degree is your oblique plane. As you can see it here, it's dividing a body like almost at 45 degree. So that is your oblique plane. If it's not 0 degree, if it is not 90 degree and any other angle is included here, so that's your oblique plane. The simple definition of the oblique plane is this. So this is basically the summary of all the planes here. So first, just go with the coronal or the frontal plane, dividing the body into the anterior and the posterior halves. Okay, so the axis is also called as the anterior and posterior halves, and axis is also called as the anterior posterior axis. Anterior posterior axis is here, and the movements were, let me just give you one more view of the movements of the frontal planes. That is this, that one was the abduction and the adduction at the shoulder joint. This one was the inversion and the eversion at the ankle subtalar joints, and the one was the lateral flexion at the spine. Okay, so these are the frontal coronal plane movement example. Now we are having the second, that is the horizontal, also called as the axial or the transverse plane. Okay, it divides the body into the cranial and the cranial or the caudal part, or the top or the bottom. So the axis will also be the top or the bottom part. So the axis will be the longitudinal axis, and the movement will be at this longitudinal axis, and the movement will be the horizontal abduction and the adduction at the shoulder joint. This one. Okay, the lateral rotation and the medial rotation at the elbow joint. This one, and the pronation, and this one is the supination at the radio-ulnar joint. Now we are having our third plane, that is the plane sagittal plane or the longitudinal plane. It consists of a two plane, that is the median plane, that is dividing the body into two equal halves, that is a median plane, and the right and the left and also equal. Remember this word, okay? Whereas the parasagittal plane also divides the body into right and the left parts, but not equal is not here. Okay, so you have to remember these things. What are the movement at this? Any flexion movement is basically, that is the flexion movements are the elbow flexion and the extension, trunk flexion or the extension. This one is the trunk flexion and the extension movement. This one is the elbow flexion and the extension movement, and this is your dorsiflexion. Here in this video only the dorsiflexion is being shown, but if you move your foot further downward, that will be your plantar flexion. So these are the movement at this plane and the axis. So now the last part is basically the cardinal plane. Cardinal plane are those plane that passes through the center of your body, and your center of the body is the center of gravity. This center of mass, that is where all the mass of the body is concentrated and where the gravity action is maximum, means the force of gravity acting at that point is maximum. So that's your belly button, that is your navel, that's your center of mass or the center of gravity point in your body. And any plane which passes through that point is the cardinal plane. So we have three planes that passes through that point, that is the median plane, that is the coronal plane, and last coronal or the frontal plane, and the last one is the transverse or the horizontal plane. Transverse or horizontal plane. Okay, so which horizontal plane, which plane is not cardinal? Any plane which is not being passing from the center of the body, that is your parasagittal plane. It was parallel to the median plane, so how could it be passed from the center of your body? Parasagittal plane, and I guess I messed up with the spelling, there was double G. And one more plane was oblique plane. Oblique plane does not pass through the center of your body. So that was all about the plane and the movement which is being occurring at this plane. So what's basically the importance of the planes? Planes give you an idea of the axis, and on that axis certain movement of the body is being occurred, and you are getting these planes at which position. We have learned three positions, that is the anatomical position, the prone position, the supine position. So it's basically on the anatomical position. As you can see, this person is in the anatomical position, this person is in the anatomical position except the hands. Okay, these not the hands, the palm basically, and this person is also in the anatomical plane, this person बेचारे का आधा part ही नहीं. So okay, so that was all about your planes of the body. We are done with it. That is the imaginary line dividing the body into certain parts and giving you an idea of an axis, and on that axis the movement is basically occurring. It can be any movement, so you must have an idea of the movement as well. So that was all from my side regarding this topic. If you guys have any query, you can drop it down in the comment section, I will answer it. So thanks for watching.